Current evidence suggests that vaccines give long-lasting protection against severe disease and hospitalization, but their effectiveness against infection can decrease over time. We consider the emerging evidence and recommendations from the Alberta Advisory Committee on Immunization, and along with Omicron's variant's arrival. And I'm pleased to announce that we're expanding access to booster shots to all Albertans aged 18 and older. People will be eligible when 6 months have passed from their second dose, and the rollout will move forward in stages. The next stage will be Albertans aged 60 and older who will be eligible for third doses beginning next Monday, December the 6th. We're offering third doses to older people first, as we did with first and second doses, because older people are at an increased risk of severe outcomes from COVID-19. Appointments will open tomorrow for anyone in this age range who received their second dose at least 6 months ago, and they can receive their third dose as early as Monday next week. As a reminder, eligibility for boosters is based on birth date, so we ask you to please wait until you turn 60 to book an appointment. Going forward, we will open up bookings to additional age groups as long as we have supply. We anticipate that bookings for all adults age 18 and over will be open by early next year, but the exact timing will depend on the volume of appointments booked and the availability of vaccine supply. The Omicron variant's arrival in Alberta is another reason we encourage all Albertans to get fully vaccinated if you haven't done so already. Vaccines, combined with current public health measures, remain the most effective way to protect yourself, your loved ones, and your community from COVID-19 and its variants. If you're already fully vaccinated, I urge you to book your booster dose as soon as you are eligible. In terms of what the uptake is going to be, we'll have to wait and see, but I'm very pleased that we're heading almost to 90% on first doses, and so people who have already made the choice to get the first dose and the second doses are coming up, so hopefully we'll maybe in that range for the third dose. We are going to continue to provide information to individuals about the effectiveness of vaccines and urge them to do so, and continue to answer their questions. We're also working on a strategy to provide more information to deal with those who are vaccine hesitant at this point in time, because we still have roughly 10% of the population, and we're going to continue to work on that 10% to get it as widespread as possible.
Over the last 24 hours, we identified 430 new cases of COVID-19 and completed about 10,800 tests. Our positivity rate is 4.1%. There are currently active alerts or outbreaks in 147 schools. 8 of these schools have had 10 or more cases infectious in the school in the last 14 days. Our hospitalizations are slowly declining over time. There are currently 424 people being treated for COVID-19 in hospital, including 79 in the ICU. Having said that, it is important to note that these numbers are still very high, and current ICU COVID numbers are double the peak of ICU impact from an average influenza season. Sadly, 7 new deaths have been reported to Alberta Health in the past 24 hours. I send my condolences to the people grieving the loss of these Albertans and anyone else who has died.